The Monument Avenue 10K is back Saturday, April 22nd for its 24th year as thousands prepare for the race day. We have Dr. Paul Caldwell, an orthopedic surgeon with Bon Secours, sharing ways to lower your risk for injuries. Thank you for being here, and I want to get your practice in that you're with. It's Bon Secours Tuckahoe Orthopedics, in case people want to know. So race day's coming up. What's the first? Just don't be nervous, right? Be ready. You've trained for this.
Yeah, prepare for it. Most of these people have gone through a program to prepare, and I think obviously making sure you're good and warmed up before you start the race is important. Do a little dynamic stretching so you don't get through the first mile and injure yourself.
And what should you do to start? What are some of the steps you should take to prevent injuries? Because I know that's like you've been training so hard for this, and that's kind of the biggest fear. What's going to happen right before the race?
That's a great question. I think most people taper before their race so they don't overdo it, and then obviously get a good warm-up, before they start, and then obviously make sure they start slow on the day of the race would be fantastic.
You may want to go really fast and beat your time, but trust your body.
No doubt about it.
All right, so we've heard that poor nutrition can lead to conditions that increase your risk of injury. So it's important what you're eating leading up to it?
For sure. There's no doubt about it. Running is so repetitive, so making sure you get plenty of calcium and vitamin D in your diet really helps prevent stress injuries.
Is that just what you like, different types of food you're eating, or should you be taking vitamins and things like that?
I talk to my runners about supplementing, particularly their vitamin D. As we're coming out of the winter here, we don't get as much sunshine. I think that's important to prevent stress fractures.
All right, so what are some of the common injuries, the dreaded word injuries, if you've been preparing for this, that you should watch out for or know something's not right?
Yeah, in running, it's very repetitive, so we get quite a bit of lower extremity injuries, particularly Achilles tendonitis, patella tendonitis, and then we get also stress fractures. So those are the most common injuries, and I think a slow, steady progression of your training will prevent these.
Can you beat them last minute or still run, or is that when you need to visit a doctor and find out?
That's a great discussion. We have that in the office all day, for sure. So come on in if you have questions before the race.
I'm sure it's case by case, depending on the injury. But so if something's not right, you might want to call.
Exactly.
If a runner suspects an injury, what should they do? What's the #1 step?
Yeah, the #1 step obviously is stop running for sure. And we kind of categorize those. If you feel a pop or have swelling or have bruising, please come in quickly. If it's a gradual injury, just take a couple days off from running and start back low impact would be my advice.
And we're 2 weeks out now, so this is the
crunch time.
This is the crunch time.
Yeah.
But listen to your body.
For sure.
What kind of treatment options does Bon Secours that you offer?
Bon Secours has you A to Z. We have trainers, we have physical therapists, we have primary care sports medicine, and then we have orthopedic surgeons in every area. So we've really got you from one end of the spectrum to the other.
And when a big race like this comes up, do you see an influx of patients into the office around this time, or is it after the race?
It's usually after the race. Most everybody kind of, suffers through their injury, so to speak, until they really have to see a doctor.
But you shouldn't suffer through if it's something that's...
Too bad. You don't want to cause permanent injury, no doubt.
And that can happen. Do you also get a lot of, what is it called, plantar fasciitis?
Very much so. If you don't stretch after you run and just go sit down after you run, that's a very common injury.
And that's annoying, painful, can really hamper someone that's trying to run, right?
That first step out of bed is very tough.
And you know it, and that's when you try everything you can you can't really fix that in a short amount of time, can you?
No, that's unfortunately a long-term project.
That's what I thought. All right. Well, let's see. I want to make sure I got everything here. Anything else that you think is important to stress to all those people that are about to go out and have a great time and they've been training for this? What do you say to all of them?
Well, just pace yourself, take a couple days off before the race, make sure you continue to do low impact such as biking or swimming or even some yoga beforehand because the run's going to be fine.
All right, well, Dr. Paul Caldwell, I'm going to make sure I get this right. Bon Secours Tuckahoe Orthopedics, thank you so much for your time. A lot of great information for anyone running or anyone who might think about running in the future.
Thank you for having me.
Accurate.